hospital systems being quite a traumatic place to go when somebody's suicidal. And from my own experiences as well, that is probably even more intensified in some autistic people as well. With the emergency room is not a particularly pleasant place to go to, and when you're in high distress. So there are going to be situations that are essentially an emergency as well. And we do need to take somebody to the hospital, but there's ways that we can try and navigate that and give the person decisions to make along the way still. So, if you're calling an ambulance for somebody, you can say, or like even a step before that, let's say, do you want me to drive you to the hospital? Do you want to go in an ambulance? Like, you're giving these options of like, we know we need to do this, but it's what would make it the best version of it for you in this moment. So if an ambulance comes, we can ask them on the phone to have their sirens and lights off for that whole trip. You know what I mean? Like that kind of, there's these little things that can help somebody, hopefully that, like the actual going to hospital or wherever it may be and getting the help that they need is not adding to the stress as much as possible. But yeah, there's definitely situations where the ED might be the place to go. We're kind of just saying, when somebody comes to you and they're like, I'm feeling suicidal, if you go, well, I'm calling 000, you've kind of brushed them off, and like, it's not validating of their feelings and what they're going through in that time. Just take 5 minutes even and just sit there and hear what they have to say first. And then you can still go.
So you've skipped the steps is what you're saying.
Pretty much.
So you skip. So
yeah.
So what are the steps in basic terms? Okay, so you're saying you validate them, you hear them.
Yeah.
And then what do you do? You ask them why you feel like.
Yeah. So yeah.
Why you feel like that? What would be an example?
I think it's really good idea to be really curious about their experiences. Like, we've heard examples of, I think this was an example from Lifeline. Like, a question that they asked people who were calling up Lifeline was, what would it mean or what would it feel like for you to take your own life? And essentially in that question, they're saying, what's going on for you now that's you're finding so difficult you want to take your life? And what would taking your life actually bring you? Is it relief? Is it these, there's a whole bunch of things that could come up there. So I think that kind of curiosity is a really good thing to hit on when you're kind of having a conversation around suicide. Like active listening essentially is what it's called. Like,
rather than judgment.
Yeah, judgment or even trying to solve or fix anything in that moment.
But I'm autistic, that's what I do, mate.
I know. Yeah, it's a challenge.
How do you navigate that when your brain says fix things?
Yeah.
It must be hard to navigate.
I think it's